There's so much important information that we don't know. For example, the fact that they hadn't tested the system end-to-end, at least until a week before October 1st, and yet they still went ahead and launched this thing. They didn't have the security clearances set up, the security protections. The site crashed after 100 users.
And there are memos. There are memos.
There are
right?
memos.
The contractors not given memos. Scott Gottlieb?
The contractors, the memos on... The HHS knew about these problems.
The contractor said it's not ready.
On paper. Yeah. Paper. Bob Leshevsky, on paper. Is that what we're going to discover? The contractors tried to warn them. They wouldn't listen?
Yeah, there's no doubt about it. They're pointing fingers at each other already. A number of decisions that were made here were political decisions. For example, the architecture of the site, that you couldn't browse plans until you signed in with all of your identity information because the administration wanted you to look at the net cost so that no one would claim there was sticker shock, for example. So much of this, and I think they launched on October 1, knowing there were serious problems. I mean, all the testimony up on the Hill is that HHS, the Obama administration, knew there were very, very serious problems with security, with systems crashing, and yet they went on October 1. Why? Because they had been telling the public, they'd been telling the insurance industry, they'd been telling each other, they're going to go on October 1. And I don't know what they thought was going to happen, but they went on October 1.
The general refrain in Washington is that CMS, Medicare and Medicaid Services, which was quarterbacking this, was reporting directly to the White House in an office that's managing the introduction of this plan in the White House.
Who ran that office?
Jean Lambert is running that office, and her name has popped up in some of the articles recently.
She ran the White House office?
She ran an office in the White House that is basically overseeing the implementation of this.
And you're going to tell me, hang on a second, I was at Level 3.
She's on the Domestic Policy
Office
Council.
of Management and Budget. So I know how this game works. There is a Domestic Policy Council. It meets with the president. You're going to tell me the senior person in the White House staff on this subject did not meet with President Obama, and he actually can look at Americans with a straight face and say, I didn't know?
Well, certainly
I find that incredible.
She was meeting with him. You know that.
Of course she was.
The question is, what did she tell him, and what did CMS tell her? And what did she believe?
And what did the president decide? The president may have said, you know, they'll figure it all out. Let's launch it on October 1. We don't know. I think your point is valid.
I just think it's incredible. Oh, but I'm going to ask you, we talked about this before we went on the air. Are you surprised? This is a serious question. Are you surprised at how fast this thing blew up? Seriously.
I'm surprised at how fast it is, but I'm not surprised by how it has blown up. You know, I've been reporting at Forbes for 9 months about all the different IT problems, the privacy problems, the development. Henry Chow, the guy, the IT chief at CMS, had said 9 months ago, I'm afraid this is going to be a third world experience. And everyone thought he was joking at the time. He clearly wasn't.
Scott Gottlieb, Dr. Scott Gottlieb, okay, I'm a 60-something broadcaster, okay, pretty good health, etc. But why do I need lactation services? Why do I need maternity services? Why do I need abortion services? Why do I need a whole fistful of sort of speech therapy?
Well, it goes well beyond that.
Why do I need that? He's telling me I need that, and that stuff is part of his 10 essential mandates.
Well,
why?
Any service that's mandated, it's given an A or a B grade by the United States Preventive Services Task Force, a body in Washington, now has to be covered in full by all private insurers in this country, not just in the individual market of the exchanges, but employer-provided coverage, because they want the insurance companies to cover what they want them to cover.
Why can't they have differentiated products? I don't get that.
That would be a competitive market.
In other words, if GM and Ford, they had different cars, okay? Can I be that simplistic? They had different cars. They have Explorers, they have Fiestas, I don't know what they have.
This is the biggest problem with the exchanges.
Why can't they do that?
You don't need lactation services.
I don't.
But
I don't.
If I need lactation services,
you can buy it.
I need you to fund it for me.
I
need your money.
I don't want to fund it for you.
Your wallet, Larry.
See, that's the thing, isn't this? This is the adverse selection everybody talks about. But young people in good health are supposed to finance everybody else. That's basically what this is. Now, I'm not. Maternity wards and maternity services, fine. I'm for babies. I'm pro-life, as a matter of fact. But I don't need it at my age. And young people may not wish to have it at their age. Then they get it later on. Why can't that be flexibility, or is this just what government does?
It's healthy people as well as young people. Young people are healthy, and that's why they're adversely affected. But it's healthy people generally. Healthy 50-year-olds are going to be paying for sick 50-year-olds and sick 30-year-olds. It's healthy people in general getting hammered. They're the ones whose premiums are going to go up the most.
This is the biggest problem with the exchanges, is it's not a competitive structure because you can't buy policies that match your needs. It's basically one size fits all. The only thing that changes is the copay structure.
That's right. That's exactly right. Did you find out that you were canceled?
I found out about 3 weeks ago.
And what are the direct implications for you? How does this thing really affect your life?
The bottom line is I currently have an individual Blue Cross Blue Shield of Michigan PPO. I'm extremely happy with it. I've been battling cancer for 6 years. My premiums are high, but Blue Cross has taken excellent care of me, as well as my University of Michigan doctors. I got this letter 3 weeks ago saying my insurance was being discontinued or canceled as of December 31st. I'm currently receiving chemotherapy, IV infusions about every 3 weeks, which is an improvement. As of May, I was receiving them every week for almost 2 years, and I'm devastated. My premiums are absolutely skyrocketing.
And I just want to say Godspeed on the cancer battle. That's a very important point before we go back into this technical stuff. What will happen now? Are you going to, I assume you have options, you're going to switch plans. If that happens, let me just ask you, what about your oncologist and what about your doctors? Do you lose all that?
I'm hoping I will not. I'm currently with University of Michigan. When I last got my chemo, I talked to my doctor about it. I told him for the first time, instead of living day by day, I'm looking ahead. I have to choose between bronze, gold, or silver coverage, which is, like I said, skyrocketing. So at this point, I'm trying to decide which plan to take and whether he will continue to be with the plan and cover me.
Who sponsors this plan? Who would sponsor it? Are you talking about the Obamacare bronze plan, or is someone else sponsoring that?
I could not get on Obamacare. As many times as I've tried, I could not get onto the Obamacare site. So I called my agent, and I'd very much like to stay with Blue Cross Blue Shield, as they've taken really good care of me. And all I'm after right now is keeping my plan, paying the rates that I have. My husband is a saint. He's 72 years old and still working, so he can support me and get me through this.
How much
Larry,
more
can
expensive?
I ask Joan a couple questions?
Yeah, please, go ahead.
Joan, you called Michigan Blue Cross.
Yes,
okay.
I'm talking to an agent.
Well, and I think it's very important for people in this circumstance to call their existing insurance company, because you can get through and they can give you some help and you don't have to wait for the website to open up. First of all. Secondly, did anybody talk to you about whether or not Michigan Blue Cross has an early renewal program?
No, no, they didn't.
Okay. Check there. Most of the plans are offering something called early renewal, which enables you to change your renewal date on your plan and keep it until December of 2014. Now, I don't know if that's the case in Michigan. Some states, believe it or not, are prohibiting it.
Oh, really?
But make sure your agent checks to see if you have an early renewal plan. You might be able to stay on, as millions of people are finding out or are getting these letters, you might be able to stay on your plan until December 2014.
Joan, how much are they charging you more for this
new
plan versus the plan that you had last year, in 2013? How much are your premiums going up?
My out-of-pocket costs, which is the bottom line, because they've thrown in co-insurance deductibles, and the out-of-pocket cost is going to be anywhere from $4,500 to $6,500 per year. And I'm paying what I think is have a very expensive plan right now. And I definitely want to stay with the PPO.
How much is the premium going to go up?
Well, again, if you look at the premium, depending upon which plan I take, it gets very confusing. My premium may drop, it may go up, but the bottom line cost will go up from $4,500 to $6,500 per year.
So $2,000 more for the deductible. And you know what? The other challenge is going to be that a lot of these plans on the exchanges don't use academic medical centers, because medical centers like the University of Michigan are the most expensive medical centers. So most exchange plans don't allow you to use those providers.
And that's my concern. I mean, I have excellent doctors, and I want to stay with them. I mean, they're the reason I'm alive. I've been battling this disease for 6 years now.
Have the doctors made a decision yet whether they're going to contract with any of the exchange-based plans? Have they told you whether they've decided to do that?
I don't know. I've talked to many people at University of Michigan, and everybody's very confused, as well as me.
Most doctors haven't signed contracts, and the ones who are going to haven't done it yet. So,
well, Joan Carrico, first of all, as I said before, good luck and God bless.
Thank you very much.